Okay, Frank, Bill has the easy job. All these people want to come in here. They're dying to get to Miami. He's got all those luxury products to give them. Now, how are we going to add, can we sell luxury, not luxury, can we sell quality and add jobs here? This is a little harder.
Well, I think, Mark underscored it. I think that if you're talking about what we market, we have to market here what's world class. I mean, what we excel in. There are many things that we excel in here, particularly when we're recruiting on the business side. One of the challenges we have, though, is in the marketing in of itself, because this community has really progressed as a business center. But interestingly enough, in some cases, it's the world's best kept secret, because we just don't have the resources to be able to market it. I think that one of the unique things, I'm going to put a little plug in, is that in many areas where you see the Hatfields and the McCoys between business and the Visitors Bureau and various areas, we knew this and actually came together in a very unique marketing campaign called Where Worlds Meet, where you actually have the Visitors and Convention Bureau, the Beacon Council, business, and our Visitors and Convention business, but also Baptists. Our healthcare providers stepped up and said, we're going to participate. We've got American Airlines participating. When I say participating, I mean cash in the deal. They've sort of spoken for real. And also the DDA. That's allowed us to go from a $500,000 marketing campaign, which basically couldn't market us past Brickell, to $2 million, and now we're about $2.5 million, and our goal is to keep increasing that. So what are we trying to market? Well, let me first start by saying world class. You really couldn't say this a few years ago. If I would have said it, probably would have got laughed out of the room. But let's start with the airport. Our airport really is one of our drivers. If you've gone through it, you can see that what's happening there. But what it does is it's more flights to Latin America and the Caribbean than any other U.S. airport. As a matter of fact, it's almost more than every U.S. airport combined. #1 in international cargo. So our airport is one of, no question, the driver. So we have to make sure it is high quality, stays high quality. We won't talk about how we got there, it's been a little messy, as you know, but the fact of the matter is we're going to have a quality airport. Our seaport, same way. Cruise capital of the world, that helps Billy, but most of what goes through there is cargo. And the fact is that they're going to be 50 feet depth. They're going to be able to attract Panamax ships. It's going to help us with our connections, not only to Latin America, but to the Far East. They won't have to wait in queue in Long Beach. They can come right through. Airport, seaport. But let's go on what we market. Multilingual, multicultural population. We operate in the international arena because we're international. 50% of the people, more than 50% of the people who live in Miami-Dade were not born in the United States. I'll say that again. 50% of the people who live here were not born in the United States. What does that mean? We come from all over. So we know how to do business all over. And our ability to do that business has made us the business center of the Americas, the gateway to the Americas. You pick your term. But the reality of it is that, but we need to keep quality to maintain it, because there's a lot of folks who want that title. Right now there's about 10 cities who call themselves the gateway to Latin America. So, I think and at one time it was New Orleans, and they sort of blew it. And now it's not New Orleans anymore, notwithstanding the Saints coming here. The fact of the matter is that also we've got consulates here. Third largest number of consulates in the United States, and back of Washington, New York, then us, and trade offices. That fosters international business. Our educational system. I'm not saying it because Mark's here. The reality of it is our post-secondary and postgraduate education, our master's and MBA programs, are on a par with any place. If you look at our telecom, Billy said you wouldn't have think of luxury when you mentioned Miami. How many of you would think that Miami is the 5th best telecom city in the world? But that's how it's been ranked by many of the IT magazines. Why? Because we have one of the only U.S. network access points. We have a major Telefonica data center. We have that kind of infrastructure. Healthcare. We have excellent healthcare facilities, and yes, internationally. And that does attract people, because if a company's going to relocate, where am I going to educate my people? How are we going to have the healthcare that we need? And then where are we going to live? Housing. And again, 5 years ago, with an average median price house of $345,000. Not so much easy to get people to relocate here. But now, Ron, what are we, below 200,000? Well, that's, that's sort of, we all dread that. But the fact is, we are very active now with companies looking here. Why? Because they can find affordable housing for their folks, either in housing, and it's quality housing, and it's a quality place to live. So I think that when we talk about our sectors, would you believe that we're probably one of the best? We mentioned healthcare, but we have one of the largest clusters of bioscience not only in the state and the country. You've heard about Massachusetts and other areas and out in the West Coast, but we have a growing research and bio-life science industry here that, quite frankly, is going to be equal to anyone anywhere in the world. So we have those kinds of ability to attract the kinds of international and domestic companies that are here. I often like to say our diversity, which many of us thought in the past was maybe a liability, is now our biggest asset. Because when you look at what's happening, I like to say wherever the U.S. is going demographically, Miami's there already. We know how to deal with it. We've dealt with it. That's one of our biggest assets. So we have that. We've got lots of challenges. I don't know if you're going to ask that question. Hopefully not. But the reality of it is we do have those challenges, but we have lots to be proud of and lots to sell, but we just have to be able to get the word out.
Brian, you've already told us about the fact that you believe in this in the healthcare field. Let's talk about business in general, because you represent the private sector more than anybody else on this particular panel. How can business yardstick itself against other places, other locales, other businesses, in order to measure how good we really are? You talked to me about how the Baptists are doing that. You said some of that. How can the rest of the community follow your lead?
Well, again, we look at it locally, but we look at it globally. We have a huge international program. A lot of folks don't realize that it's probably the 5th largest in the United States. We have about 12,000 patients a year, and we're doing about $75 million a year. And we're trying to attract those people over here. And we're not, we're not really competing locally. We're really competing with the Mayo Clinics and the Johns Hopkins and the Texas Heart and what have you. I think on the quality standpoint, we're starting to show very definitively on our quality graphs how we compare to these facilities. So when people are going to Texas, they're going to the Mayo, we've got the same data and they've never seen it before. So we're going to obviously be very aggressive in sharing the information. I think the best argument I can make for our organization is telling people, if you've never been to Miami before, try it. If you've never been to Baptist, just try it one time, because we'll blow their socks off. And a lot of it is word of mouth. We got just absolutely wonderful people. As Bill was talking about the service component, people don't understand the clinical component too much, but sophisticated, educated people are going to do their work on the internet, and they're going to look at the acuity adjusted morbidity for cabbages. That's like the kill rate for surgery, for open heart surgery. And they're going to make a determination on that, and they're going to say, well, do I want to go to this facility or this facility? Do I want to go to Miami? You come to Miami, you go through the airport, you go to the international, it's one-stop shopping. We take care of everything. If you go to Boston, you go to other places, I would suggest to you, you don't get that same type of hands-on care. You certainly don't get a bilingual or trilingual staff. Most people speak English and they have a little bit of Spanish. And so it's a whole different environment. So we have a phenomenal advantage. And so our plan is to leverage the difference out of it.
But how about other people outside of your field now? What advice would you give to other businesses in this community as how they can yardstick to you can show your quality. You've got measurements. You've got all sorts of numbers. What about other industries and other businesses?
Well, I think in the hotel industry, Bill, I think it's all reputation based. You know, because it's the experience you have over there, and it's the word of mouth, and it's written up in Condé Nast magazine, all the ratings, you know, the star ratings and all the point ratings and what have you. That to me is very, very important. And you're competing there, and you know everybody is loading information into the surveys. You got to make sure you're better off than everyone else, because if you end up low over there, there's a lot of people who have never been here, and if they have lower ratings, they're not going to come here. They're going to go into other facilities. So our goal is to make sure on a global basis we compare very, very favorably, and we're going to be very aggressive in terms of educating and telling people and promoting what it's all about.
Frank, how would you look at that for other industries in terms of what they can do so that you have firepower when you're selling, and so that when they're selling as well? I mean, any business that can show I'm better then somebody else I'm competing with in another area should have an advantage. So
Well,
what should they do?
I think a lot of it is, are they leaders in their field within a particular industry? You know, where do they rank? How successful are they? How successful have they been since they've been in Miami? Have they increased their market share? Have they been able to hold and retain their employees? It's interesting because we deal with this topic almost every day. We just recently had 2 location consultants coming in saying, you know, we're representing a major company. We don't know who they are, who's looking maybe to relocate to Miami. They wanted to meet with many of our companies here. They met with, actually, I think your HR person at Baptist and several others. What do they want to know? What kind of employees, how you can recruit them, what is the satisfaction rate, what are these major companies that are here, how are they doing? So I think that, again, it goes back to what Mark started us out with, is are you a leader in your field? How well are you doing in that field? How are you recognized by your peers? I mean, it's kind of interesting to be able to say, oh yeah, and by the way, do you know Mark Chernow and Pascal Goldschmidt, and if you're in the bioscience area? Well, yeah, they do, you know, world class. And again, I think it goes back to that kind of measurement and metrics that these companies are looking for.
Mark, when we're looking abroad, are there specific things that you would think that we should be doing to promote quality in a way that might be different than when we're promoting it within the United States? All of us have everybody at this table has an interest in looking abroad, and it's a key component. What should we be doing that would be different in that regard?
The community has strategic core competencies. The community has cultural affinities, and it's probably the case that we need to be far more focused and targeted in harnessing those offshore. And as Brian was speaking, I was thinking about the fact that we do have in this community probably upwards of 12 to 15,000 international students. And if we take all of our higher education institutions. And Brian mentioned the fact that you're marketing more aggressively towards the international patients. Now, I can tell you that I haven't felt that as it relates to the obvious connection between the international students who attend Florida International University, which is a top 20, and that marketing effort. I didn't feel it when it was part of One Community, One Goal, and I don't feel it today. But yet I think there's a natural multiplier there that speaks to the strengths that we have. So I think perhaps stepping back, taking a breath, figuring out where we do have clusters that can provide strong linkage offshore with individuals who are already predisposed to appreciate the strengths that we have. And I don't yet think we have our act together there. And I'm not just referring to health, but I think in other areas it comes and goes. It comes and goes, and probably right now we could harness it a little bit better. We'll have to actually to go to the next level.
Where would that be harnessed? Are you talking about in individual institutions or community-wide efforts?
No, I think it has to be a community-wide effort. What characterizes our community historically and to this day is fragmentation. And there are good reasons for that. First of all, the broader evolution of our community is one of fragmentation, except at certain points in time, largely brought on by crises, whether it's let's say a Hurricane Andrew or the particular catastrophe that we're dealing with now in Haiti. But it really does have to be the product of a real focused exercise and a lot more consensus in our community than we currently have today.
Bill?
Let me put in a plug for FIU, because you're talking about quality and global. And really nobody understands this, and FIU was chosen by the Chinese government in a stiff international competition from the top hospitality schools in the world, and was chosen by the Chinese government and totally financed by the Chinese government to train its students and its future leaders in hospitality. That's the Tianjin University of Commerce. Outside of Beijing, they have high-speed rail now. It's about 30 minutes away. So it's a leader in the world. And this is an emerging market. You know, it's an emerging market. And so how are we getting into China? You know, it won't be, probably in 2020, China will be the #1 tourist destination in the world, inbound and outbound. We have an outpost. This community has an outpost in China. The students in Tianjin come here, and the professors, Chinese, and the students from here go there.
Bill, how many are we talking about in this case? Do you have
Numbers.
We have about 2,000 Chinese students who are studying at our university in Tianjin, and upwards of 150 to 200 Chinese students from that program alone, you know, go through FIU on an annual basis.
That's a very significant numbers?
And we embrace that. We're getting our arms around that. Is how, I mean, you can't advertise in China yet because the U.S. doesn't have approved destination status, but we have used those students, and I'm on the advisory committee for FIU, in the trade shows in China, the China International Trade Marketplace. In the U.S. Pavilion, we're the only destination in the U.S. with Chinese students who are being trained in China by a Miami University, speaking to folks in China. It's incredible. That's what we're doing as part of quality, and FIU doesn't toot its horn enough, because people say, what are you doing in China? If you look at our newsletter this week, as a result of those relationships, we have 20 of the top journalists from China in town, probably today, probably in some of these hotels, reporting on this Miami brand. You know, we're all global. I've been to China several times, and it's going to be huge. And you want to be there before it gets away from you. But kudos to what FIU is doing in that emerging market. We're working in India as well, but you take advantage. But FIU competed against all of the top universities in the world. The Chinese government, a pretty picky bunch, wrote a check. They say it's a $30 million campus. If you build it today, it would be a $150 million campus outside of Beijing. Having faith in a Miami university to train their future leaders. Bravo. That's what this destination is about.
Mark, and I put in a plug for FIU too for the medical school, which I think is first of all, I think the law school is a coup, especially when you look at the approval rate for the bar exam. You guys knocked the socks off the ball in that one. And the medical school is something that is going to be a huge contributor to this community. But on the healthcare side, if you look at the Obama law and the Obama legislation, you look at healthcare reform and you look at healthcare costs. One of the basic problems with the United States, and specifically down over here, we don't have enough primary care doctors. Now, I don't know how I can go around the room over here. I bet you everybody has 4 or 5 doctors. You got your urologist, you got your orthopedist, you got your cardiologist, you got this and that. Who takes care of your whole body? That's a primary care physician. And what happened was, when managed care hit about 15 years ago, they used a very condescending term to define primary care, and it was called gatekeeper. I thought, what a terrible term. You're going to go to a gatekeeper, and now they're providers. And that sort of took the gloss off of primary care, and we lost those doctors. And I think all the best people in healthcare today realize how critically important they are. I think you'd call them quarterbacks. I think everybody ought to have a primary care doctor that knows everything about you, that's been with you for years, as opposed to somebody that you spend a couple days with, a couple hours with, and you go on from doctor to doctor. There's no continuity over here. There's tremendous waste and duplication. That's what primary care is all about. And what Obama's going to do, we're going to change that dramatically with healthcare reform. What's going to happen is going to be a redistribution of the professional revenue stream of dollars going away from the specialists, maybe even some away from the hospitals, to primary care, because everybody realizes how really important that is. And you guys are going to have one of the first primary care medical schools in the country, which is a reason that we decided to affiliate with our West Kendall Hospital. We think that's really important, so congratulations.
Thank you.